Time now for Morning Rounds, our look at the medical news of the week. First up, putting your health in your hands. A new study out this week from the American Cancer Society looked at the number of cases and deaths where modifiable risk factors played a role. I guess that's things you can change.
Yeah, the researchers used 2014 data to draw those conclusions. They found that an estimated 42% of all cancer cases are a result of risk factors we potentially control, and that an even higher 45% of cancer deaths are a result of these factors. Joining us to discuss the findings is CBS News contributor Dr. David Agus. Doc, so I think this is good news as far as people who want to be able to say, I can affect my health outcomes. What are the risk factors?
Well, it's good news and it's bad news because we're not doing it. So this same study was done about several decades ago, and what they showed is that it was smoking was the dominant risk factor. And over the last couple of decades, smoking has gone down, but obesity-related cancers have gone up, and they've kind of taken the place of smoking. So the big ones are smoking, obesity, lack of movement, sitting or being stagnant all day, and things like HPV vaccine, right? You get a vaccine, you can prevent cancer. So those are the critical ones. We hit those, we're going to dramatically decrease the incidence of cancer in this country.
And I shouldn't really be sitting down for this next topic, but I guess I'm going to have to. It is...
I think we have, just before we get to our next topic, let's just wrap up.
But you're welcome to stand.
I will. May I address the audience?
Our cancer conversation. Are there certain cancers that are more implicated than others when we talk about these risk factors?
Yeah, so lung cancer is the big one, right? I mean, lung cancer, 85–90% is related to smoking. Smoking in this country is still there. 19% of kids in high school still smoke, which is an astonishing figure if you think about it. So we need to decrease smoking. Things like colon cancer, breast cancer can be related to obesity and what we eat. So both of those are, again, addressable. We get away from the processed meats and other things, colon cancer rates will go down. If we, move more, if we and we have less obesity, we're going to get less breast cancer, which is going to be dramatic.
Now, I am obviously eager to get on to the next subject, but I have one more question on this current topic.
The answer is yes.
We know that overeating and smoking tied to cancer. That message is out there. How do we make sure people are actually getting it?
Well, I mean, you hit it, right? Is that the problem is that if I tell you to do something today, it's not going to help you till a decade, 2-3 decades from now. That lag in health is really killing us in the big respective things. So how do we do that? I mean, we need to educate and to really get people to understand. And so when you tell patients what to do, they just roll their eyes. You explain to them why. Hopefully behavior changed.
Yeah.
Literally, you can decrease your risk for cancer if you do this.
Yes.
Okay.
All right, is it time? Can we go?
It's time.
I want to talk
Go
about
for it, Tony.
I really should not be sitting down for this one. Our next topic, taking a stand for your health. Many workplace environments require employees to work at a desk. No surprise there. That can mean a lot of sitting, which has been implicated as a health risk. A new study published by Biomed Central examined a select group of German desk workers. It compared the time they desired to spend sitting, standing, and doing physical activity versus the reality. Desire versus the reality. I would like to do a lot more walking around. What did they find?
Well, I mean, people want to walk more than they do. And I think people are also surprised how much they sit. I got one of these little watches, and I was shocked how much I was sitting during the day. I've got a treadmill desk. At least once a day, I'd go for a walking meeting, and it makes a big impact. Remember, we were designed to move. Our bodies were designed to move. So the more you move, you actually decrease cancer and heart disease. Those data are pretty impressive. And so redesign your life. Never have a printer at your desk. Have it somewhere else in the building. Go to a different floor to go to the bathroom at work. Try to figure out ways to move.
That seems drastic. But Doc, I mean, I have a standing desk, and I am very thankful that CBS has a standing desk for me. You have a treadmill desk. Not everybody can have these things in their workplace environment, right? Certain jobs lend themselves to sedentary behavior.
I love that. When I said you have to get up to walk and go to the bathroom, you said that seems drastic.
I was going to say maybe get a pipe and go for a walk, but
Alex,
maybe not.
We just need to figure out ways to simply redesign our life. Is that if you can walk for 5 minutes an hour, you've done a major impact on your health. So get up, walk around. Don't call someone 3 offices down. Walk over and talk to them.
Yeah.
Steve Jobs, we used to meet, and we used to go for walks. He said, David, there are 2 reasons to go for the walks. He goes, the first is the health benefits. He goes, the second, if you're walking and you get to the corner and you know you're going to turn left, right, or go straight, gives you an advantage in the business negotiations.
Ooh.
So he had every little angle walked down, but figure out ways to bring in walking to your life.
Why is it on us? We should be on the companies. They should make some changes.
No question about it. I mean, redesign the floors. We do environmentally designed buildings. Who's doing health design buildings?
Why are we sitting now? Should we all? No, I'm not going to do that to our camera guys. Dr. David Agus, thank you as always for your time and thoughts.
Thank you.